expensive, and you're only treating a few people. Well, you've increased your effectiveness, but you certainly limited your access. Our objectives for this particular project, certainly we wanted to improve the efficiency of care for both the staff and the clients. We have to expose our clinical staff to the tools of the future. We wanted to identify the barriers that could be preventing the widespread implementation. Now is the time for that. And certainly we want to maintain quality in all those 4 dimensions that I just mentioned. Implementing hasn't been that much of a problem. I introduced it at the management meeting. Everybody said, oh, this is great, you know, good quality, money coming in. No resistance whatsoever. And I really had to identify the staff who were comfortable with computers and who would be willing to participate. And really most of our staff did. We only have 3 or 4 prescribing people who I didn't want to participate, really. So by way of introduction, I just told them about the project through personal communication and email. We started in January. I had to select a coordinator, who is our lead medical assistant. Her job is to make sure everybody's doing their thing. As it turns out, because of getting patients entered into the system, she actually spends at least a half hour to an hour putting new patients into the system so it doesn't slow down the people at the point of prescription. And in those 15-minute visits, you know, the expectation is that a patient's going to leave with a prescription. We cannot delay it till, we'll call it in later on today. So it's got to be done right in that 15-minute block, you know, especially for the client who tends to come 5 minutes late. So, okay, and to make sure this project met our standards of participation, I just said everybody's got to do at least 3 Medicaid clients per day. So it's 3 physicians, 4 nurse practitioners participating. We've got 3 medical assistants involved. And it turns out we're averaging 304 e-prescriptions per month. As far as the other features that you heard the other speakers talk about, we're all using the desktop version, so apparently we can't get that data. So that's all I can tell you. Okay, so I thought you might as well hear it from the prescribers themselves. Now, every quote here is from a different person. So if you take a look at the first domain, which is effectiveness, we've got some multiple quotes here. Drug interaction information, the ability to see all the medication that the patient's taking is helpful. E-prescribing is very helpful. Able to see the other medicines for my patients. Most of the time they don't remember to bring a list or name of the PCP, and I'm also able to monitor their compliance. So far so good. It's wonderful to see the many potential interactions and see what the patient is prescribed by other providers. I've been able to find out that my patients have been taking controlled pain medications. In addition, oftentimes the patient really does not know what other medications they're being prescribed. And one last one. On several occasions, I've learned of meds prescribed by another provider, and the information is very useful to me. Sometimes, especially when the patients seem not to want to share that information. That happens quite a lot. Sometimes, however, the patient just doesn't know the names of the other meds, and when it's there in the system, it's a whole lot easier. All right, now when we get to efficiency, this is where we start to run into some problems. If you look at efficiency, efficiency is a measure of the resources required to yield a product. Okay, so for us, time is the resource, the prescription's the product. So you'd be more efficient if you could produce the same number of prescriptions in less time, or if you had the same amount of time, you'd come up with a greater number of prescriptions. Okay, one person says, this program's too time-consuming to use in actually filling medications, and I feel it actually impedes patient care. Overall, it has been helpful, but the software problems make it cumbersome. Software has not saved me time. I feel that with improvements, it could save time. There's another one saying, it has not saved me any time. I can write faster. Overall, I find it time-consuming. I began to like it, but when kids are on multiple medications, it is a problem. it probably takes at least double the time of just writing or calling in. E-prescribing is time-consuming, especially if there are multiple prescriptions. It can easily add 10 minutes of work per patient. All right, so the next domain is access. One staff prescriber says, in particular, there's a pharmacy that will not accept the prescriptions, so the patient has been without meds for a day or so. In the program, the EmpowerX program, and I'm sure a lot of other e-prescribing programs, are not useful at all, as we've discussed, for the C2 prescriptions. Those are the stimulants. And with kids, they're almost all of them on stimulants. For EmpowerX, the benzodiazepines are a problem. We use one other program where apparently the pharmacies accept it through that, so I don't know why that is. There's another one saying also most clients are prescribed a controlled substance which cannot be sent through EmpowerX, so the medical assistant already has to get the chart to call in the meds anyway. Another person, it would be also helpful if it could be used for controlled substances. For adults who are on a combination of controlled and non-controlled substances, I'm not sure what the benefit the patient might see if he still has to bring in a hard copy prescription to a pharmacy and sit around waiting for it to be filled. Local pharmacies, Dr. Saz talked about, claim that they did not or get the prescription or they delete it. Oddly enough, you can call in a prescription early and they'll just keep it on hold. You could hand them a paper prescription, they'll keep it on hold. But when you e-prescribe, if it's more than a week to 2 weeks early, they'll just delete it, which gets to be a bookkeeping nightmare if you're seeing patients every 3 months or whatever. Now, when it comes to satisfaction, they're mixed results, but I've included the folks who are satisfied here. I still prefer to use it over writing out prescriptions. I've used the drug interaction function a great deal and find this very helpful. I really like the idea of e-prescribing in general and feel seeing the entire patient list of medications useful to avoid drug-drug interactions when I'm choosing a new med. And one last one, I rate my experience moderately favorable. Okay. So really, in theory, e-prescribing has just got tremendous potential for quality improvement. But the real problems for busy practices, and I don't know anybody who doesn't really have a busy practice anymore, and definitely in community mental health, access and efficiency are the major hurdles to overcome. Efficiency especially, because if it slows down the care, it's going to add cost to the care, and it's just going to be more expensive. So either reimbursement rates have to go up, something has to change, or this just has to get faster. For the access piece, change at the federal level, as you've discussed, is really needed to keep up with the technology. It really would be nice if we could send all medications through e-prescribing. And as you all know, now's the time to do it before we don't have a choice. Now is the time to fix it and make it right, and make sure it doesn't cost us more in the long run.
Question, I know with each of the other centers there was a pilot. There e-prescribing going forward?
We're going to do, EmpowerX, for example, is available to us, and those people who like it are going to continue to use it, I guarantee you that. Our electronic record has to interface with e-prescribing. So we have a Unicare product, for example. Unicare says they're coming up with their own e-prescribing. But whoever, since most places are going to be with electronic records, the software has to interface with it because nobody wants to do duplicate data entry. So.
Have you experienced higher compliance, especially concerning your uninsured population?
We haven't really pushed it into the uninsured because of the time commitment to register everybody for the Medicaid population. So we're just still dealing with the Medicaid.
You're committed to the process?
Absolutely. Absolutely. 110%.
Thank you for sharing those points.